are two identical straight lines. Kind of boring, right? But what happens when you change what's going on around them? All of a sudden, the lines seem to change in size in relation to each other. They can shrink and grow, they may change their color schemes, they can bend and compress, and they can buckle, bend, or even change directions. But even though it would seem like the lines themselves are changing, the only thing that's actually bending or buckling is your mind, the truly mesmerizing part of optical illusion. Now, optical illusions can use different colors, patterns, as well as different light schemes to change what's going on around them. The information gathered by these optic nerves can basically change them as well. Now, when I first applied for the ISM program, I knew that I wanted to focus on something that was related to the medical field, but I wasn't really sure what career that I wanted to focus on. I was going on back and forth between a couple of options, whether it was optometry, pharmacy, cardiology, dentistry, or nursing. Having gone through clinical rotations as a junior last year, I kind of had some prior experiences, whether it was being in the back of an ambulance with a bunch of EMTs going onto a car crash site, to putting leads on a person and being able to administer an EKG, and when patients were coming in and out of the emergency room, to running through the hospital when a code blue was being called. And if a couple of you don't know what a code blue is, it's when a person goes into cardiac arrest and their heart starts failing. There were fun and exhilarating things like this, but there were also simple things, such as filing papers, just cleaning beds in general, or just helping out nurses if necessary. I finally narrowed it down to wanting to do something directly related to patient care. Not that any of the other fields were bad, they were great. I mean, who doesn't like banking and money and things like that sort? So once I finally decided that I wanted to focus on optometry, I realized that there were actually 3 different subsections that I had to focus on and research. The first thing that I looked at was an ophthalmologist, and an ophthalmologist has to go through 8 years of school, and 4 of these years usually come from medical school. The 5th year is some type of internship, and the last 3 years are a residency program, whether it's in a hospital-based setting, a retail-based setting, or a clinical rotations-based setting. And these 8 years of school don't include your bachelor's degree. They do have a medical doctorate degree, so they can perform surgery, and they're also allowed to give different prescriptions to their patients depending on what they need. The second subsection that I looked at was an optician, and they're not an actual eye doctor, but they do have to be licensed, and the certification requirements differ per state. They need an associate's degree, and you can generally get that at any type of community college. And they do have different classes, such as optical math, optical physics, as well as just general classes that talk about the equipment that an optometrist would use. And that leads to my third subsection, an optometrist, which was probably geared towards me. They have an OD degree, which is a Doctor of Optometry degree, and they're also allowed to give out prescriptions, just like an ophthalmologist is, but unfortunately they can't perform surgery. They're really good with treating eye diseases and problems, and they're really specialized with pre- and post-operative care. That technically means that if you had a specific disease or if you had any specific questions, then you could go to your optometrist and they would definitely help you with understanding the process and things of that sort. They're also pretty specialized with vision therapy as well as rehab. Some other things that they focus on include primary vision care, and they're very good at testing color as well as depth perception. Once you do have your test results and they're less than perfect, which is 20/20, your optometrist will generally give you a possible treatment plan depending on the person, and this can range from glasses as well as contact lenses, and it also depends on the type of eye that you have and the shape and the structure. They also focus on the coordination of the eye in general. For my research, I wanted not only to focus on the technological advances that optometry has gone through for the past couple of decades, but I also wanted to focus on physical deformities as well as diseases of the eye. Something that really caught my eye was the Optometry bionic lens. And they were actually invented by an optometrist in Canada, and they're said to enhance the level of eyesight by about 3 times 20/20, which is the universal perfect vision. You would have to go through a painless procedure for about 10 minutes, and it's a lot similar like cataract eye surgery. You don't just pop these in and out of your mouth, your eye. The lens don't degrade over time, so you won't have to worry about any possible cataract eye problems or any of those problems like rehearsing them and things of that sort. The technology they use is a patented miniature optic system, which kind of works like a little body camera, and the actual lens are powered by your body, so they can range from your short distance vision to going over to very far, large distances much quicker than the human eye can. Launch set date is tentatively for 2017, and this type of technology isn't just created within a day or overnight. It's been in the making for about 8 years, and it's cost about $3 million US. Clinical rotation still needs to be done, and since it's almost the end of 2016, I'm assuming that they've already started and they're almost completed. But they would begin with a animal and then move on to blind human beings. For my other research, I was kind of looking at specific diseases and things of that sort, and I found something called an intraocular melanoma, which is just a fancy word for eye cancer. And it's the most common type of cancer that develops within the eyeball, and unfortunately, the exact cause is unknown, but scientists have found links with these conditions and different types of cancers. We have a thing called a BAP1 tumor suppressor gene, and if that's altered and is mutated, then that can definitely increase the chances of you getting that specific cancer, as well as other cancers as well. There are many symptoms, and this includes flashes of light, blurred vision, eyelid lumps, and pain in the eye, even though that part's pretty rare. There are definitely also risk factors, which include for race and ethnicity. Asian Americans and African Americans are more prone to getting the disease itself. For eye color, people with light blue eyes are more prone. And then for age and gender, generally you can get these types of cancers whatever age you are, but the older you get, the worse your eye gets, obviously. So older people would get them, and males are more prone to get them. There's two main sections of this type of intraocular melanoma, and the first one is called primary intraocular cancer, and that's a little bit more rare than the second one. But that's when the cancer begins in the eyelid itself and then travels to different parts of the body. And the secondary intraocular cancer is when the cancer begins in a different part of your body, so such as like gallbladder, pancreas, and those kinds of things, and works its way up to the eye. And it's actually a lot more common. The 5-year survival rate for an intraocular melanoma, if it's in the first stages and it hasn't metastasized to other parts of the body, is about 80%. But unfortunately, if it does start to spread to other parts of the body, it's about 15%. Now, besides that, there's this thing called a TNM naming system, which kind of just specifies the tumor, the nodes, and if it's metastasized. So the T in the TNM system stands for tumors, and it just talks about how big or small the tumor might be in the eyelid, and there's a specific subsection for that. It's a T0, T1, a T2, and a T3. And then the N stands for nodes, to see if the nodes by the cancer have spread to different parts of the body as well. And M is just to see if it's metastasized or not, or if it's spread to other parts of the body, or if it's just there. And for my interviews, I've been on 5 research interviews so far. 4 of them have been with people that have their own private practice or are in the process of getting it, and the last one has been at UT Southwestern. Apparently, there aren't a lot of optometry schools in the country, just a little over 60, so everyone that I interviewed except one person went to the exact same college, and that was the College of Ophthalmology in Houston, so I thought that was pretty interesting. I've gotten a lot of perspective and insight about how to begin my journey, and some fun things and cool things that I've gotten to experience are having been offered a job from 2 other places during the summer for next year, so hopefully that'll work out. But the first person that I interviewed was Dr. Brian Marshall in Dallas, and he has a private institute called Marshall Eye Care. And he just kind of gave me a couple of tips about what I should be doing for my journey, as well as what cases he's developed, as well as things that he's worked with, like the Google Lens and things of that sort of templates and things like that. And he specified that I should also be more involved with the community for my future, which kind of leads me to my quote: "We make a living by what we get, but we make a life by what we give." Winston Churchill. Thank you.